Hi, I'm Jamie and I'm the pharmacist, and today I'm going to be talking to you guys about what is hair loss, what are the types, how can we treat that, because where do most patients go first to see what they can do about their hair loss? The hairdressers. So today I'm going to talk to you a little bit about kind of everything dealing with hair loss, why it happens, and how we can treat it. So first I'm going to say that everyone typically loses about 50 to 100 hairs per day, but we don't notice because we are continually growing hair. So hair grows about a ½ inch per month on average, and that's about 6 inches per year. So really not a lot, and patients don't understand this when they come to us, come to the hairdressers, everything like that. This is the perfect time to ask questions to help patients out because of the pandemic. So in New York Times, I found that the doctors reported an increase in patients suffering from stress-related hair loss due to the pandemic, and that was about an 8% increase in hair loss in the last 8 to 12 months. So now is the perfect time to inform everyone and send them our way to get their prescriptions, because we can really help these patients out. And so I just want to talk to you guys about what it is so you can inform them, because they go to you first. So the most common cause of hair loss in men, that's what we're going to talk about first, is men, is genetic. So that's mostly androgenic alopecia. About 80% of patients of men have androgenic alopecia when they're suffering from hair loss. Androgenic alopecia is the presence of androgens. So testosterone is converted into another hormone known as DHT, dihydrotestosterone. And this is associated with shrinkage of hair follicles and shortening of the anagen phase of hair growth. And this is typically characterized by a moderate to severe hair loss on the temples and crown. Other causes of hair loss in men is nutrition, diet. A lot of it is alcohol nowadays as well. So alcohol can cause dry, brittle, breaking hair. The combination of dehydration, malnutrition makes it hard for the body to rebuild hair and function. Another one is stress, we all know. Medications actually can cause that, and that's when you would send those patients to a pharmacist or a doctor, so they can ask those questions and see what maybe is another cause of their hair loss, what medications can be causing this hair loss. Other conditions are health conditions like thyroid issues, lupus, so those thyroid medications are a big one. Then on to women. What is the most common cause of hair loss in women? That's also genetic. So a lot of it is also androgenic alopecia. That's not just in the male population, that's in women also. It affects about 1/3 of the population, which equals about 30 million women in the United States. This one looks a little different than men. So that one's an overall thinning, which maintains the normal hairline. Other causes can be hormones. So a big one is menopause. We change levels of hormones during that time, and that's when your estrogen and progesterone levels fall, meaning that affects the androgens. Male hormones are increased. So women also have that testosterone in their body, so the same exact thing happens. Another one is pregnancy. That's a big one. Maybe those pregnant women really aren't coming to you as much, to hairdressers as much, but we still see it, and we can still inform patients that are planning on becoming pregnant. So in pregnancy, estrogen increases, which makes hair grow. After pregnancy, though, estrogen levels decrease, causing hair loss. And that's usually temporary, so that's not necessarily going to be something that we would need to prescribe medication for. But we can inform those patients that, yes, after pregnancy, you may experience some hair loss, but it could be temporary, and hopefully that is the case. And then changes in birth control. Also, changes in estrogen levels when you're changing birth controls. Same exact thing. Again, medication, stress, all that stuff. Then you probably already know, but hairstyles, ponytails, cause breakage of the hair. Heat styling damages the hair. Overprocessing, probably already talked to patients about that one, but just wanted to make you aware. So how can we help these patients, and what can you kind of let them know about what's out there to treat their hair loss? So something that we, Ulu RX Pharmacy, does is we make Minoxidil. So Minoxidil is approved for female and male pattern baldness. That androgenic alopecia that I was talking about that is most common in women and men. So what it is it's a vasodilator. So it opens those blood vessels up when you add it to your scalp and helps those follicles remain intact and creates that blood flow to the head so the hair can keep growing. It does take about 3 months, if used consistently, to see a difference in that hair growth. This is not for patients under 18 years old though, so you need to make sure patients, if you're talking to them about it, they're 18 years and over. So kind of how you use this medication, and obviously they would need to talk to their doctor. With us, they could go on our website at ulurx.com and schedule an appointment as well, talk with one of our nurse practitioners, and get prescribed this medication. So how you kind of use this medication is it needs to be a dry, clean scalp before applying. You may apply it to damp hair, but to use this solution, you would fill the applicator with 1 ml. Our bottles are marked, our droppers are marked to the 1 ml line. You're going to part the hair in the area of thinning, apply that 1 ml on those areas and kind of move it around. And that would be twice a day. Gently rub that in and then allow it to dry before styling using other products, anything on the hair, and then before going to bed so it's dry before it gets on your pillowcase. And then you have to make sure that the patient is washing their hands after, because you don't want hair growing on other areas of the body. Rogaine is something over the counter that a lot of patients think about, is the first thing they may try. Rogaine is 5% minoxidil. We use about 8 to 15% because it has been shown in studies to have a major difference helping with hair growth. We also have other medications that we can add in that help reduce that DHT that I was talking about in androgenic alopecia. And so when these patients come to see our nurses, they will talk about everything that's affecting them, and the providers that we have will know exactly what to prescribe, so we can customize these medications right there for these patients. We get the prescription from the medical provider faxed in, we make it as quickly as possible and send it out in the mail to these patients. Side effects that you might want to talk about patients, or they might be kind of questionable about these medications, so you can kind of let them know what side effects are. So most is itchiness, greasiness of the hair, irritation, but with our products we can customize these. So if patients are having these issues, we can customize these products for them so it's not greasy, it's not itchy, all different types of things like that. Some patients, if they're using other products or have any condition on the scalp, it can cause some inflammation. And then patients that are that have really low blood pressure kind of have to watch out, because this does open up those blood vessels and decrease the blood pressure. But that would be something that the medical provider could talk to them about and get the right strength that the patient would need. So that wouldn't be so much of a side effect, but we can definitely customize anything for these patients. If you have any questions, you can always reach me. My name's Jamie again, the pharmacist here at Ulu, and I'm happy to always answer any questions you may have for any of your clients. Please let me know and give me a call. Thank you.